AHN are an organisation that work with the NHS at primary and secondary care level, addressing high-intensity user patients, helping them to become more proactive and self-managing in their care, and thus alleviating the pressures on the health service. The health coaching service that we offer to PCNs helps the PCNs identify those patients who are high-intensity users of their service and thus an impact on their resources. We identify those patients and invite them into a coaching intervention that helps them become more proactive in managing their own health by empowering them, building their confidence and improving their health literacy. All of our health coaches are qualified healthcare professionals, predominantly nurses, but we also employ paramedics and physiotherapists. They also undertake our own bespoke in-house training program. Health coaching supports primary care by identifying those patients who are high-intensity users. We work with those patients to develop their own ability to better self-manage and therefore reduce their reliance on the service, thus alleviating the pressures and allowing a reduction in resource impact. Health coaching reduces the GP workloads by ensuring that those high-intensity user patients start to reduce their contact with the practice and become far more self-managing, therefore allowing the precious hours and time that GPs have to be focused on those patients that really need their intervention and need their attention. We identify patients by running a query through the patient management system such as EMIS, System 1 or Vision. We use a number of criteria including attendance records, primary diagnosis, demographics to identify those patients who would be most amenable to a coaching intervention. The deployments are project managed through an initial clinical discovery meeting where we meet with key members of the practice to look at the best ways to work in a collaborative and seamless way to deliver outstanding care to the patients and the optimum outcome of a reduced impact on the service.
Once the patient has been accepted into the service, we carry out an assessment and the assessment lasts approximately 1 hour. The focus of the assessment is to enable the patient to talk about their health, gauge their understanding of their health, how they manage their health care, and any care pathway that the patient may be involved in. This call is aimed at identifying short and longer term goals with patients so that they can identify what they need to do to help them achieve their goals. This forms the basis of a care plan on which to assess and evaluate progress for both the coach and the patient. As a registered nurse, it's easy to pick up the phone and speak with our colleagues. Some examples of the colleagues that we regularly communicate with are GPs, practice nurses and social prescribers. We do see a better understanding of the healthcare providers that the patients need to see through a better understanding of their symptoms and conditions.
The initial assessment call is really important because this gives the patient their chance to talk to us and us actively listening to what they're saying. It's important that we understand what's important for the patient and how their health conditions are at the moment. Very often their conditions affect them not just physically but mentally as well. So we do provide a holistic approach to our assessments and it's a great way of sitting back and really understanding that patient and what their journey is all about. Coaching is about empowering and supporting the patient to achieve their own health goals. So we support them by listening, active listening, we encourage them, we motivate them. The impact of health coaching on patients is incredible. We often find that because we empower the patients and they are happy with the condition that they have in the sense of they understand the condition, they understand the symptoms, what happens then is they're able to differentiate between when a pain is just a nuisance and when that pain needs to be looked at properly by a GP.